I'm Rick Buck, and I've been a dentist for 17 years. A patient came in the other day. When I look at the x-ray, you can tell the tooth has a lot of infection around it. So I will show you how I extract this tooth, and then at the end, I'll show you kind of what went wrong and why it ended up needing to be extracted. After I numb the patient and press on the tooth and gums to see if they're fully numb, it becomes apparent that there's pus seeping out between the tooth and gums. I wasn't expecting to film this part, so it is a little out of focus. But pressing on your gums and noticing pus could indicate the presence of an abscess, which is a pocket of pus caused by a bacterial infection. It's crucial to seek dental attention promptly, as untreated gum disease can lead to serious complications, including tooth loss and systemic health issues. Next, we move on to the extraction with my elevator instrument. With a firm grip on the elevator, I gently wedge it between the tooth and the surrounding bone. I apply controlled pressure to loosen the tooth from its socket. At first, it feels solid as a rock as I try to release it from the socket. But as you will see in a moment, with each firm and precise movement, I can feel the resistance of the ligaments and bone gradually giving way with those ligaments breaking free. The bone is slowly expanding and the ligaments attaching it to the bone are breaking slowly but surely. As soon as the tooth begins to loosen, I take my time, ensuring minimal trauma to the surrounding tissues. With patience and finesse, I continue to elevate the tooth with clockwise and counterclockwise pressure on my elevator until you can see it becoming quite loose. Next, I grab my forceps to change the direction of my pressure. And I didn't capture this next part well, but as I do, the crown pops off of the tooth, which is common. Quickly, before I get to the most interesting part, I developed the best toothbrush, floss, and other dental products that are in Amazon affiliate links in the description. Those dental products will give you a stunningly clean mouth. You should watch my videos about why they are the best, posted at the end of this video, so you brush and floss with superior results. Extracting a molar with forceps requires a delicate balance of precision and patience. I carefully maneuver the forceps around the tooth, applying gentle pressure to loosen its grip within the gums, ligaments, and jawbone. With each subtle movement, the tooth begins to yield, its roots releasing their hold, the ligaments attaching the tooth to the jawbone stretch and break, and the bone expands. It takes patience to take the tooth out. If I become impatient and put too much pressure, the tooth can break, making the extraction more difficult. You can see how each step of the way the tooth inches closer and closer to coming out. You can really see in this video how a tooth slowly loses its grip from the socket, and eventually you can see how far the tooth comes before it actually comes out. These things can really hold on for dear life. Now, yes, it is satisfying when the tooth comes out, but I want to pause and show you this tissue that comes out with the tooth called granulation tissue. Granulation tissue forms as a response to infection and inflammation within a tooth abscess. When bacteria penetrate the tooth's pulp, the body's immune system triggers an inflammatory response, leading to the accumulation of immune cells, dead tissue, and fluid in the affected area. I try and clean up as much of this tissue with my spoon as possible and rinse the socket with ozonated water. As the infection progresses, the body attempts to contain it by forming granulation tissue, a soft pinkish red tissue composed of new blood cells and connective tissue. This tissue serves as a barrier, helping to wall off the infection to the surrounding structures so the infection doesn't spread. Quickly, I want to show you what went wrong, which may only make sense to fellow dentists. This tooth had a failing root canal. As I cut off the tip of one of the roots to show you a cross section, you can see this root canal was done with Thermafill. However, there is no pink gutta percha that made it down this far that is necessary to seal off the root canal so it would prevent further infection. If Thermafill worked, this pink gutta percha would have been down all the way into the center and the tip of the tooth. And you can see around the black firm part of Thermafill is white, meaning the gutta percha didn't get down far enough to seal off this root. And so that is why it's important for dentists to no longer use Thermafill. Most people don't use it anymore. There are still a few dentists out there that use Thermafill, and it really just doesn't work well, and even if it does, you can't confirm when it doesn't. Watch all my daily tooth care videos I have posted now for the best techniques, tips, and products for a stunningly clean mouth that avoids tooth decay and gum disease and gives you fresh breath. My dental products are in Amazon affiliate links in the description below, and if in Southern California, my dental office is in the description as well. Like and subscribe to my channel if you have teeth.